country's first hospital to specialise in emergency care opens its doors first thing tomorrow morning. It's taken 10 years to build a hospital at Cramlington at a cost of £75 million. The NHS is hailing it as a vision of the future. And ahead of permitting its first patients, our health reporter Sharon Barber was invited in for a look around.
So it's just absolutely fantastic. It's what we've been waiting for a long time.
Staff here have been planning the opening for a decade. The hospital in Cramlington, Northumberland, is radically different to most. It's designed to take emergency patients.
This allows us to take 3 small district general hospitals and take from their emergency admissions the most seriously ill patients and bring them to instead one centre dedicated to emergency care.
This new model of hospital will not see outpatients, minor injury, or keep patients in once they've been stabilised. It entirely separates emergency and planned care.
By separating them right out into a different hospital, both streams run much more efficiently, so we can provide better acute and emergency care. And then on the base sites in North Tyneside, Wansbeck and Hexham, we can breathe out. The plan for the NHS is that we do exactly that, and that we separate those streams of care, and this is one building block in what's a raft of changes throughout Northumbria, and will ultimately be a raft of changes throughout the NHS.
Accident and emergency doctors will work here 24 hours a day, 7 days a week. So what will this new hospital in Northumberland mean for patients who currently go to their 3 hospitals, to the north, Wansbeck, to the west, to Hexham, and to the south, to North Tyneside? Well, from now on, they'll all be brought by ambulance. All seriously ill patients, that's heart attack, car accident, stroke, they'll all be brought here to this emergency care hospital, along with maternity. And that will mean longer journeys for patients.
I'm a Northumberland girl, and we all have to travel to certain destinations to seek the best possible service.
You and I both got lost finding it today.
However, but once the signs are up, it's all very, it's all very, very positive. I know that we've widely informed people of Northumberland that this is available and that the community hospitals are there for minor injury services, and that this is very much an emergency care centre.
Hospital bosses maintain treating all seriously ill patients here instead of at local hospitals will save more lives, and it may prove to be an answer for the A&E crisis. But it's never been tried in England, and so it's a model of care both the NHS and many other hospital trusts will be closely watching.
Sharon Barber joins me now. So Sharon, this new hospital will treat only seriously ill patients, is that right?
Yeah, and a quick point from the report, actually, the signs weren't up. They are up, actually, but they're covered up. But from tomorrow morning, the signs will be uncovered. And absolutely, only seriously ill patients will go to Cramlington Hospital from tomorrow morning. In fact, over the weekend, all the seriously ill patients from Wansbeck, North Tyneside and Hexham were transferred across. But any ambulance will only take you to Cramlington.
And you mentioned the 3 other hospitals in the area. What happens to them now?
Well, they're still there, but they'll only be for minor injury, walk-in, they'll be for planned surgery. This is a real separating out of planned and emergency. And they'll expand, but it will really be recuperation services as well for those patients who have been at Cramlington.
You mentioned the signs are up there now, but travelling time, some concerns?
Yes, some surprise actually that this hospital is going to take those patients, all the seriously ill patients. But yes, real concerns about travel time. Someone contacted me today to say it would take them 5 hours to perhaps go and visit a loved one at Cramlington.
OK, Sharon, thanks very much for that.